Hi, my name is Sarah Mitchell Chen. I'm a licensed clinical social worker here at Rush with the Rush Movement Disorders Clinic, and I want to welcome you to another Rush Recaps video. Rush Recaps are a series of short educational videos intended to help address some of the most common questions and concerns we often hear from our patients, care partners, and families within the Movement Disorders Clinic. This project is funded by a grant from the Parkinson's Foundation, and the hope is to address some of the things that we just don't always have time to talk fully about during the clinic visits. And so today, we're going to talk a little bit about understanding the various levels of long-term care. And so one of the things that can certainly be a challenge is even just understanding what the different terms are. And so we're going to cover that a little bit today. And we're going to also talk about how you know whether or not it's time to make a move for you or your loved one. And so this is never an easy decision for families or patients to make. And every family and situation are so different. So there's unfortunately no kind of cookie cutter way to think about this, but there are some things that might help indicate that it is time to think about a move. And so, one thing might be if someone is needing increased assistance or supervision, whether it's for physical care and changing care needs, like they need help getting up, getting dressed, getting to the washroom, and that those are requiring more and more assistance. Maybe it's taking more than one person to do those tasks, some of those tasks. Or if someone is wandering, there's maybe some cognitive changes, changes with thinking and memory, and there's concern for safety in the home. You also might want to think about a move into a long-term care if we're looking for additional socialization or kind of programs and activities that we just can't get at home if you live alone or only have a caregiver coming in for a few hours a day. You also might think about a move if the primary caregiver is really experiencing high levels of burnout, or that primary caregiver has their own medical needs that are going on and they need to attend to those as well. And so, as we start to think about the different levels of care or what a transition might look like, there's lots of names for long-term care facilities, and they often can get used interchangeably. And so I'm going to try to help separate the different levels of care. And so, the first one is kind of independent living. And so that's where people may have their own apartment, or townhouse. Maybe it's just an independent living community that provides, snow removal or groundskeeping, kind of, you don't have to mow the lawn anymore. Maybe there's a dining room that serves dinner or, lunch and dinner, and you kind of have a budget of what you need to use each month, but you're still pretty independent. The next level of care is called assisted living. And again, people may have their own apartment. They might be smaller, one bedroom or studios. And the facilities usually, this is where they begin to provide more assistance. They're going to usually help with housekeeping services. There'll be more meals offered in a common dining room within the building. They'll offer assistance with a few self-care tasks, such, for example, maybe showering or escorts down to the dining room. And then there's usually a nurse there Monday through Friday who can assist with maybe medication setup or can help with maybe reminders or things like that. But if there's an emergency in the middle of the night, there will be aides that are there to respond, but most likely you're going to be headed to the emergency room to be evaluated. The facilities will offer programming and activities, maybe some outings, and there may be some additional a la carte services that are on top of kind of the monthly costs. And so these assisted living facilities are private pay. They're not covered by Medicare or the state-sponsored health insurance plans or commercial insurance. The next level of care is called supportive living facilities. Again, people usually have their own apartments, and the facility will assist with those housekeeping tasks, providing some meals in a common dining room, assistance again with some certain self-care tasks, like showering is often a pretty common one. And then they have the nurse that will help with the medication setup. And again, in the event of an emergency and supportive living facility, you'll be going to the emergency room to be evaluated. They're not designed like in a hospital emergency room to respond in a crisis. Now, depending on the state, supportive living facilities might be covered by the state-sponsored health insurance plan, but they're not covered by Medicare or the commercial insurance. The next level of care is called skilled nursing care. This is where people might have their own room or a shared room, and the facility is able to help with all self-care tasks, such as getting up, getting dressed, getting to the washroom, getting a shower. There's a nurse there 24 hours a day, and the nurse has taken over both the med management and the medication administration. So you don't have to worry about any of those things. They're also providing all of the meals and can accommodate a special diet, whether it's a change in the consistency of the food or the thickness of your liquids. Now, skilled nursing facilities are private pay. They might be covered by your state-sponsored health insurance plan. They are not covered by Medicare or commercial insurance for long-term care. Now, you might have heard of people going to a skilled nursing facility for short-term rehab. And so this is a little bit of a caveat. Medicare and commercial insurance will pay for short-term rehab. And so short-term rehabilitation happens after a hospitalization with, for help transitioning from the hospital back home, after a fall or surgery or illness. And so during short-term rehabilitation, they're able to provide physical, occupational, speech therapy, maybe some wound care, closer nursing support and follow-up. And then many skilled nursing facilities are, in the short-term rehabilitation, you might have some additional help or support that you can find out about. But there's pretty standard kind of programs and services that are covered and offered. Short-term rehabilitation, like I said, is covered by Medicare and your supplemental insurance, most often by the state-sponsored health insurance plans or commercial insurance after a hospitalization. And so with Medicare, you can be in a short-term rehabilitation up to 100 days. It's not guaranteed, and it just kind of depends on what the needs are. And the facilities, there might be a copayment or a portion of the cost you're responsible for, but the facility will let you know kind of when they verify your benefits, what your responsibility might be. Now, another term you might have heard thrown around is memory care. And so memory care can be provided at assisted living or in skilled nursing. And basically, it's a supported area that's designed to help provide care for people who might be experiencing changes with their thinking and memory. And so the staff in memory care may have some additional training about how to kind of best support people with changes in their thinking and memory. They're usually self-contained, so all the activities and programming, all the meals are going to take place in a locked unit, which will reduce the risk of someone kind of wandering, which sometimes can be a symptom associated with changes in thinking and memory. Again, it will kind of, the memory care kind of varies depending on where it takes place. In assisted living, it will be private pay. In a skilled nursing facility, it might be something that can be covered by the state-sponsored health insurance plan or paid for privately out of pocket, but it's not covered by Medicare or the commercial insurance for long-term care. Now, sometimes we think about what are called continuing care retirement communities where all of those levels of care I just mentioned, independent living, assisted living, supportive living, skilled nursing, short-term rehabilitation, memory care, they're all on the same campus. And so people can kind of transition through those various levels of care as maybe their needs change. And that can be helpful because it kind of reduces the number of transitions. You don't have to move to another town over and get used to a totally new environment or totally new staff. You'll have familiar faces. Your family will have familiar points of contact, which can sometimes make transitions into long-term care go a little more smoothly. And so we think about, how do you know what the right level of care is for you or your loved one? And, you want to try to find the right level of care for now, but also kind of anticipating the future. We don't want someone to get into a situation where they don't have quite enough care and they've made a move, and now we have to quickly make another move to find increased support. And so, we might think about, are you able to get yourself dressed, get yourself to the washroom, get yourself in and out of a chair, and kind of walk from your room down to a dining room, or utilize a motorized scooter that you can get on and off of and get down to a dining room. Then assisted living might be the appropriate place for you. You're getting help with housekeeping, you're getting help with the meal preparation, maybe showers, but kind of for chunks of time during the day, you're okay on your own. That's probably the right level of care for you. If you're needing help with more of your self-care tasks, when you need to go to the washroom, you need help. When you need to reposition in a chair or get into bed or out of bed, you need help. You need help getting to the table for meals. Then you're probably going to be more appropriate for a skilled nursing facility where you have someone there 24 hours a day, 7 days a week to help support you. And you might want to ask for input from your healthcare team, your physician, your primary care doctor, or your movement disorders neurologist. They're going to both be able to help you think about what are the needs we have right now and what might we anticipate for the future. No one has a crystal ball. We certainly don't know, but we do have an idea of how things tend to progress with some of these illnesses. And so what might we be expecting in the next 6 months, in the next year or 2 years? Certainly there can be unexpected injuries or falls or illness that can kind of send us down a different path or have us making a different decision. But if things remain the same, what might we anticipate? The facilities are also going to want to do their own evaluation to, again, determine what the most appropriate level of care might be. And if you fall within, kind of what their community is able to offer. And so you just want to think about, how do we make these transitions as smooth as possible? How do we help support both the care partner, the family, the individual receiving the care through these transitions to try to help them, remain as smooth as possible, because this can be a big transition. We hope that this helped answer some of those questions and tease apart the various levels of care. Thank you for joining us today for this Rush Recaps video. Check the Rush Patient Education page for the growing library of Rush Recap videos. And if you have ideas or suggestions for future videos, don't hesitate to let us know. Thanks so much and take care.